tool is not really meant for presentation. It's meant for, if you like, self-study, or to, I'm assuming everyone can hear me, is that true? Yes, okay. So this tool is really meant for self-study and will be available on the web for people to go through it at their own pace. So you'll notice that it's got quite a lot of text in it and a lot of links to resources, hopefully. So what we're talking about when we're talking about amoebic gill disease and Neoparamoeba perurans and the things that are needed to control it. Well, the problem itself is a parasite, unsurprisingly. Neoparamoeba perurans is a generally thought of as a free-living marine amoeba that is widely distributed in sediments, in the water column, and attached to various organic and inorganic surfaces. And it's the causative organism of amoebic gill disease. One of the things about it is it's probably just a free-living organism that got lucky and finds fish as a tasty food. It may not be a dedicated parasite, although it's clear that it may change its behaviors according to the food sources it's on, and it may change its the things it secretes and the way it behaves when it's on a salmon. And it's particularly a problem for the gills of salmon, which is where it likes to be. Here we have a picture of the amoeba with extended pseudopodia, which it uses for movement and feeding. It's very widely distributed across a very wide range of taxonomic species, of different species from different taxa, which suggests, so we have salmonids and wrasse, and also lumpfish, mackerel, turbot, and ayu. So it suggests that it's very non-specific in terms of what it likes to be on. In salmonids, where there's a big problem, the salmonids are susceptible throughout the marine phase. Whenever they're in full seawater, they'll be susceptible, and particularly in the first few months. So smolts are quite stressed by the transfer, their immune systems are down, and perhaps that makes them a bit more susceptible. So if we look to the things that affect infection, and we look at what causes mortality, they settle on the gills, and you can see signs of disease depending on the environmental conditions, within maybe 4 to 28 days, depending on temperature, salinity, maybe the stock of the fish and other aspects. And you can see the disease in terms of pathology of the gills. These white lesions are associated with the gill disease and may get worse. I should also say that paramoeba is also associated with, or it's one of the components of complex gill disease, which is another caused by a number of different pathogens and another a range of different environmental variables. In terms of the symptoms, because it affects the ability of the fish to respire, then you get hyperventilation as the fish tries to compensate for the gill damage, and eventually loss of equilibrium, and fish can die from it, particularly under adverse environmental conditions when temperatures are very high or there's low oxygen in the water. The infection dose will affect the onset of the disease and also the stocking density. So high stocking densities will also affect it. So we get these raised multifocal white lesions, so spots of white across the gills. We get more severe under more severe conditions. And these are caused by the amoebae, which you can see hopefully in this bottom picture here, causing damage to the gills, which causes the gills hyperplasia, sort of overgrowth of the gills that effectively fills in the normal surface area. So there's a very small surface area to respire, and therefore the fish gets more and more difficulty getting enough oxygen. You also see these features of amoeba apparently in little vesicles. So these are actually open to the outside. It looks like an enclosed vesicle, but it's not actually within the tissue. It's still open to the seawater. And you also get an increase in mucus production as well. In field trials, people have found that there's a difference in the rates that different families survive. So some families it may kill all the fish, whereas in some families have a reasonably good survival. Well, that's not a good survival, but better, relatively better survival. And the average survival rate, at least in Taylor's study, was about 32%. And as I said, stocking density can have a major effect on that. The main risk factors for infection, particularly high water temperatures, especially in northern waters, temperatures greater than 12 degrees are a risk, and above, say, 15 to 16, there's a very high risk. And they mostly disappear from fish in the winter, although probably they may still be in there in low numbers. It's just that they're not a problem for the fish. High salinity is also a risk factor. And if you have high salinity and high water temperatures, that will be a major risk for infection. And as I said, the amoeba are really around in the environment anyway. They're there all the time probably, and therefore it's very easy to get infected when environmental conditions are poor. Anything that aggravates stress in the fish, so movement, grading, treatment of fish for sea lice, for instance, moving them about, can aggravate AGD-related mortality because they're having problems respiring. Anything you do to stress the fish and cause them to need to respire more, especially at high temperatures, will be a problem. Poor cage hygiene, including high biofouling, will also be a problem, partly because it slows the flow of water through the cages, but also because the amoeba can live on the cages and on fouling organisms. So having poor cage hygiene means they'll stay about longer and are there to infect the fish. Poor water circulation and water quality are also factors, and anything that causes damage to the fish gills in the normal course of events, so things like algal blooms, stings from jellyfish, and debris from net changing activities, again, including stingers from hydrozoans, will also have an impact on their susceptibility to amoebic gill disease. So they're constantly being shed into the water. So if you have large numbers of amoeba on the farms, those will be shed into the water and can infect other fish directly. So fish can get infected by amoeba in the water. They can get infected by fish-to-fish transmission, and that's the way that we very often do challenge trials. In tank trials, we'll have infected fish and place them in with naive fish to start an infection. And probably the number of amoebae, as you might expect, a number of amoebae shed into the water is proportional to how highly infected the fish are. But you can start an infection from down to 10 cells per litre in water, so it doesn't really take very many amoebae to get an infection started. As I said, stocking density has a significant effect in tanks in particular, but also probably in the field, because that's associated with fish welfare and stress. The parasite is around in the water column anyway, both in the water column and particularly attached to sediments. So where you're in closer contact with sediments, there may be worse problems. And high temperature and salinities can lead to higher problems. Once your fish are infected, probably the prevalence is 100%. So all fish will have some level of infection. But as I've said, that may differ between individual fish and between individual families. In terms of how husbandry practices, the stocking density and the infection dose affects the time to the disease onset. And by disease onset, I'm talking about the visibility of the disease rather than there being simply amoebae present on the fish. In terms of environmental conditions, it was noted, at least in Tasmania, whether that applies in northern waters, I'm not sure, that most of the positive sites were tidal, and they contained mud or sand for most of the infected sites. And also AGD positive sites were shallower, and that suggests that they're picking them up from sediments, or at least the amoeba are present in sediments. They'll live everywhere, both in the sediments and free living in the water column or associated with living organisms. And once they're suspended in the water column, they spread out their pseudopodia into sort of star shape, and that will keep them suspended in the water column and present to infect fish. Those can be detected by PCR if you're looking to find them in the water, and they're easily found in the vicinity of the salmon farm, but not so common in water samples away from fish farm sites, though I'm sure they're still there. It's just their numbers are probably lower per litre, so that's a sampling artifact. So a lot of reports suggest they're in inlet water from aquaculture facilities, and they can survive on their own for at least 14 days, and probably because they're free-living species, not parasitic species, they're quite happy living on their own. They don't need a host. We've talked a little bit about role of substrates, and they're quite high at shallower depths as well. It's not clear why that is, and reduced to lowest density far away from the cage sites. And it should be said that whatever your activities on the farm to clear the amoebae from the fish, that doesn't make the amoebae go away from the environment. So they'll still be there in sediments. So while a site is in use, and probably when it's not in use, there are still free living amoebae in the sediments. And I suspect that will be related to organics in sediments, because they're free livers and will probably feed on bacteria when they've got no fish. So what can you do about this, which is obviously the big question here? One of the critical things you can do is to monitor the levels of the disease and act accordingly. And the most common monitoring method, initial monitoring, I'll talk about some others in a little bit, is the gill scoring. So Taylor and colleagues developed a gill scoring method that scored the gills from clear of lesions to at 0 to a score of 5 with very bad extensive lesions covering most of the gill surface. And it's very important to keep monitoring them. And if you know the temperatures and salinity are high, you need to monitor more often, because this can come on quite quickly. And it tends to be that producers should be treating as soon as they see indications of the disease. It's no use waiting until you get to a score of 3 before you treat, because you may not be able to stop the infection progressing. So it's very important to treat as early as possible. The main two treatments are freshwater baths and hydrogen peroxide treatments. Freshwater can be brought from shore. That's quite logistically difficult. Or nowadays you can also use systems for producing low salinity or fresh water from seawater or brackish water that at something like 3 parts per thousand can still be used to control amoebae. If you're using fresh water, it's better to have soft water than hard water, because the calcium in the hard water lets the amoebae bail themselves out more quickly, and it's more difficult to kill them. And in theory, there's a reduction in the AGD for maybe up to 21 days post freshwater treatment, although this is really if you judge it from a pathology. So you'll see a decline in the pathology and a clearing of the gills, but that doesn't mean there's no amoebae there, and those numbers will start to climb relatively quickly after treatments, so they don't go away completely.
2-minute warning.
2-minute warning, okay, I'm getting there. Hydrogen peroxide is another way to do it, and it is as efficacious as a freshwater treatment, but it's very much influenced by temperature. So at the high temperatures, when you have problems with amoebae, you won't be able to use hydrogen peroxide easily without killing the fish. So husbandry practices to avoiding poor water quality, high stocking densities, removing dead fish, because they can live on the gills of dead fish. They're not really dependent on them being live. Avoiding continuous artificial lights, because that increases prevalence. Rotation of cages and sites, and possible fallowing of sites, though some people have found they're still there again, because they're free-living organisms, fallowing won't be as successful as it is for other sorts of parasites, and using types of nets that decrease the biofouling or cleaning the nets frequently. Having higher flow sites will help you to keep the amoebae off, and again, monitoring the gill infection levels, both by the gill scoring, but you can also use swabs to take the amoebae off the gills, and qPCR to evaluate the numbers of amoebae or the amoebic load and get a heads up, get an early warning that there's going to be a problem. You should also monitor resistance build up for freshwater baths, and it may be possible to rotate treatments to try and stop resistance building up. Because you know it's going to happen again, you need to be very vigilant about the disease coming up again. Can't really, for most sites, disinfect the seawater, but for recirculating aquaculture facilities, you may be able to do that. And also it's wise to disinfect equipment and transport tanks using the normal sorts of disinfectants. There's potential for breeding salmon. Obviously, I was thinking about food here because that's a common feature of me, but you can also breed salmon, and there's some good evidence suggesting that there's differential susceptibility to infection, and therefore a number of breeders are looking at the possibility for breeding more resistant salmon. And we've been working, whilst we and other people have been working on vaccines, we've not had success yet, but there's good evidence to suggest that they might be effective in the future if we bring the right tools, and Parafish Control has produced new vaccine candidates that we'll be able to use in the future. And then that's just a lot of references that you can read at your leisure, and I think that's me finished there, if we're lucky.
Great, thank you. Then Carla, you are next up.